Yeah.
Cool.
Got it.
All right, there's somebody else still coming in from the waiting room, and we will get started in 30 seconds.
How you doing?
Doing well. Welcome.
Welcome, everybody.
Gonna get started in a minute here. And if you could let people in from the waiting room as they come in, we're gonna get started here.
Certainly will.
Good evening, everyone. It is good to see so many faces here. I know that there are both candidates and voters in the room here in the Zoom room. We're gonna have this is a Washington, D.C. Recovery town hall meeting. You're going to be hearing from people who have lived experience with substance use disorder and recovery, folks that have been impacted by substance use disorder. My name is Aaron Kacharsky. I'm a person in long-term recovery myself, which means that I haven't had a drink or a drug since September 6th of 2003. And so just a little bit about a month ago celebrated 19 years. And I shared that. Thank you. I share that because yes, I'm a person in recovery. I'm somebody that pays my taxes. I'm somebody that's been gainfully employed, involved in my community. And as you all are, I think anybody that comes out to a town hall meeting is civically engaged, which is great. And I am also a voter, and I think that's important to share. You know, and I've worked on political campaigns. I vote in primaries. I vote in general elections. Whether it's a presidential year or local, I get into it. And I just want to share that as a recovery voter, you know, I've really gotten used to talking to candidates that are running for office, and just really kind of having that conversation of, hey, you know, this is what it's going to take to earn my vote. And I think that you're seeing that sea change happen, not just in Washington, D.C., but really across the country, where the recovery community, you know, that's people in recovery, family members, allies of the recovery community, I really feel like is one of the fastest growing voting blocks nationally. And this is something that when you take away the political party at the end of people's names, this issue, people come together on and have come together on. But there's also, and this is, you know, just kind of for the candidates in the room and the advocates in the room, I just wanted to share that there was this saying that came out of the disabilities rights movement. And the saying was nothing about us without us. And the reason why I repeat that is because for a very long time, people that have not listened to people in recovery or people impacted by addiction or don't have that lived experience have been making decisions on behalf of this community. And so one of the things that we worked to do with the Washington, D.C. Recovery Advocacy Project is start this vote recovery campaign. And we are registering people to vote. We're doing voter education like tonight. We're doing candidate education. We sent out a questionnaire to every single candidate in Washington, D.C. That is running for office and asked them to fill it out. And as a voter education piece, you can read where all the candidates stand on we asked everybody their kind of their stance, you know, on this issue and if they have a connection to it. And so if you're a voter, I'm going to put that in the chat. And even if you're not a voter, oh, this is important to, hold on a second. Give me 1 second. I'm going to put the candidate survey responses in the chat box for voters. That's right here. So if you want to go check that out and see the candidates, and we got candidates that are running for Attorney General, for the mayor's office, for delegate for the U.S. House of Representatives, for City Council, and so Board of Education. And so candidates at all levels has filled that out. So please go there and check that out before you cast your ballot in the general election. And Recovery Advocacy Project does not endorse any particular candidate. This is really about voter engagement and voter education and candidate engagement. And so the other piece that I just wanted to share, that if you live in Washington, D.C., and you haven't taken the vote recovery campaign action yet, we're figuring out how many voters are in each ward, and so we have a campaign to do that. And you can register to vote here if you're not registered, and then also if you are registered, you can pledge to say, hey, I'm going to keep recovery issues in mind when I go to the polls. And so that's the action that I just put into the chat. And then the last thing I'm going to share before I turn things over to Anna Jones, who is going to facilitate tonight, is we built a recovery voter resource hub. And so you can learn, you can register to vote here. You can find deadlines. If you don't know where to vote, you can find it here. You can look at different issues in terms of what vote recovery means. And vote recovery really does mean something different to each person in recovery and each family member. You know, there's a lot of intersectionality. You know, I care about recovery, I care about housing, I care about harm reduction, I care about mental health. There is intersectionality with all of those issues. And so we expect that candidates pay attention to those issues when they are running for public office to represent people in their constituents. And so without further ado, I wanted to turn things over to some of our team members on the Washington, D.C. Recovery Advocacy Project team. Anna Jones, who's just, if people are in recovery community and in Washington, D.C., you know Anna Jones. And so I'll turn things over to Anna. Thank you all so much. And I'll try to keep dropping some links into the chat that might be helpful to voters. Thank you.
Wonderful. Wow. Thank you, Aaron. Thank you so much. And I am totally excited, right? DC Recovery Vote Town Hall is on. It's happening. Wow. So my name is Anna Mabel Jones, and I'm a woman in long-term recovery. And what that means for me, I'm a long-time Washingtonian, and I vote. But what being a woman in long-term recovery means for me is that it has changed my life. You know, it has given me back. You know, I'm a homeowner today. You know, I'm a wife today. I'm a mother today. I'm a grandmother today. So it's just an awesome ride, and being able to have a voice, and I'm an organizer. So that means a lot to me. And we have two awesome speakers here for you today that are going to talk about what it means to be a voter in DC and some of the things that's important to them this year for voting. So our first speaker is Ambrose. And if you could please mute your phones, because we want to give the attention to our speakers. We're going to have two speakers who are voters for DC. And then after that, we are honored because we have some candidates who, again, in that link, you can see the questions that were answered and what they gave as their answers. But we're going to have our candidates share with you about their thoughts. Each one of the candidates will get 5 minutes. And then maybe afterwards, if we have some time, we're going to do some Q&A. Okay, so that is how our agenda is going to work today. So I'm going to introduce our first speaker, the DC Recovery Voter. And this is Mr. Ambrose Lane, Jr., and he's known as a longtime activist and community builder in the District of Columbia with over 35 years of leadership experience as an effective organizer and executive. In the late 2013, Mr. Lane founded and is the current chairman of the Health Alliance Network, DC's largest community health advocacy organization, to advocate for residents of poor and low-income communities and seniors in wards 7, 8, 5, 4, and 1. The issues of health equality, population health policy, chronic disease prevention strategies, and the need of change in community and health culture to bring about healthy and thriving communities. In 2019, Mr. Lane was elected by DC Mayor Bowser to serve as the second term as a commissioner for the DC Commission of Health Equality. He is the co-founder and former board member of the Black Coalition Against COVID. Mr. Lane is also the current certified master trainer for both of Stanford and University diabetes and chronic disease management programs. He has assisted in writing of past DC Council health legislations, including legislative on health impact assessments. He is the former first vice president of the Health Committee chair for the DC Democratic Black Caucus. He is the past chairman for the DC Department of Health's Chronic Disease Citywide Collaborative and has worked directly with youth, elected officials, community leaders, and businesses. He is an institution builder and specialist on organizational development, including board development, and is the original author of Legislative Creating the DC Youth Advisory Council, which instrumental in creating the youth non-voting position of the school boards of the District of Columbia, DC, Howard University, the DC Alliance of Youth Advocates. In 2014, Mr. Lane was the campaign manager for the DC City Council at Large candidate, Reverend Graylin Hogler. Born in Pennsylvania, PA, Mr. Lane attended Howard University and is a Ward 7 resident, is the father of 4 children, and is married to Dr. Nora Green Lane. With that, I'll give you Ambrose.
Thank you so much, Anna. Thank you. That was the short version. I really do appreciate being here. Those that know me know that I am completely about community. But we're here on a very serious matter, and we have a number of candidates. And I'm going to define and describe for you the situation and describe what the opioid crisis is right now in the District of Columbia. So from 2014 until 2021, there have been 1,265 homicides in DC. But from 2014 until 2021, there have been 2,042 opioid overdose fatalities. And over the last few years, opioid deaths have been almost double the number of homicides. Through June of 2022, which is the last time that the Chief Medical Examiner released information, there have been 213 deaths due to opioid overdose, from 209 at the same time in 2021 and 214 in 2020. In 2021, opioid deaths rose by only 3.5% across the city, but in Ward 7, deaths rose by 26%. The overall trajectory is on track with 2021. However, there appears to be a significant decrease in deaths in wards 1, 2, and 3, and the under 20 age group, probably from good messaging and some community education. But thus far, there are projected increases in the 20 to 29, 30 to 39, and 40 to 49 age groups, with a projected 100 deaths in the undomiciled, that is the unhoused. The 50 to 59 age group remains the highest and is projected to plateau around 120 for the 3rd year in a row. With that said, we are still on pace to have over 400 deaths due to opioid overdose. The main culprit is the synthetic drug fentanyl. Now, there have been 108,000 deaths across the country in 2021, and of those deaths, 66% of those deaths involve fentanyl. But in the District of Columbia, 96% of all opioid deaths have involved the drug fentanyl. Fentanyl, which is an opioid, has been found in cigarettes, marijuana, heroin, cocaine, and pills like Percocet, oxycodone, and in other drugs. It is sometimes present even if the victim doesn't know it. There's a report that it has been sprinkled on roses and freely passed out to women on the street. There's another report that actually states that fentanyl has been created in pills that have the colors of rainbows to be able to appeal to younger and younger age groups. Fentanyl is a poison and is present in 96% of all opioid overdose deaths. The counter to an overdose is the administering of naloxone, or better known as Narcan, to someone that appears to have overdosed. It can save a life. Narcan has been fairly well distributed in communities through community-based organizations and residents as a harm reduction strategy. So what do we need to do moving forward? In 2022, early 2022, the Opioid Solutions Working Group, which was created by the Health Alliance Network, created a resolution that was passed to all of the advisory neighborhood commissioners east of the river. This resolution was passed by 8 out of the 10 commissions representing more than 124,000 people. So it has broad support. Because of the new hospital to be located in Ward 8, we need a 24-hour treatment center with wraparound services to be located probably in Ward 7, where we saw a 26% increase in deaths over the last year. We also need continued expansion of Narcan distribution. For example, the Health Alliance Network wrote a letter to the mayor and to the city council chair and to members of the council calling for Narcan distribution in our high schools, at the colleges of UDC. And we have also asked for Narcan to be available at government buildings that do business with the public. We've also asked for Narcan to be available on metro buses and on the metro rail system. We also need continued expansion of Narcan distribution, but we also need to develop a single stream of certification for peer specialists and recovery coaches with career wages and reimbursable expenses for outreach. We also need more destigmatization efforts designed to define addiction as a disease and not a human failure. That is why we are here today, to define addiction as a disease and not a human failure. We need a well-funded continuum of care infrastructure model of outreach, treatment, and recovery, especially before entertaining any thoughts of decriminalization. 84% of opioid deaths occur within the Black community, so the efforts at solutions should be very heavily weighted towards the Black community. And I just wanted to share a couple of different things with you. We are really focused on addressing the opioids. We are working with Live Long DC. We are working with DBH. We're trying to work with the council on creating this 24-hour treatment center east of the river, because that's where the problem is. And some of our partners in the Opioid Solutions Working Group include the MEDI, PIW, Psychiatric Institute of Washington, the Ward 7 and 8 DC Prevention Center, Family Medical Counseling Services, LCHC, Tom Carl with R1 Learning, Joanna Dolan. We have several, Rhonda Johnson, the Oxford House. These are the members of the Opioid Solutions Working Group. And our goal is to have solutions that come up from the community themselves, from people themselves that have lived experience. And this is important because of your vote. Your vote becomes very, very important, not only for those that are running for office because you have to set the policy, but for others that are voting. I'm a voter. I'm a Ward 7 resident and I'm a voter, but you have to vote on what is going to be best for the residents of the District of Columbia. The opioid crisis is at the point of being an emergency. And we need to know what those that are running for office plan on doing, plan on supporting, but we also need to make people recognize that they need to vote and vote for something that will eradicate this poison out of our communities forever. So thank you very much for having me, Anna. I really appreciate it. And I hope we continue to have a lively discussion on this effort.
That was wonderful from one of our DC voters. Yes, and what we need. Thank you. Just so many awesome points and, just awesome data that we need to know to help save lives. So our next speaker, who is definitely a DC voter, is going to let us know why they vote, we want you to meet Miss Johnson, right? Rhonda L. Johnson is a native Washingtonian and a resident from the nation's capital, Washington, D.C. She is the CEO for New Hope 2 Reality, LLC, certified business and small business enterprise. Ms. Johnson has published 4 books that address education, hope, innovative solutions regarding addictions, mental health, and suicidal ideation. She is also a Washington, D.C. certified peer specialist, a recovery coach, speaker, facilitator, and advocate for change and transformation regarding stigma, discrimination, and implicit biases that are affecting our communities. Compelled by societal lack of knowledge, stigma, and misunderstanding regarding what are co-occurring disorders. Ms. Johnson has been a voice for change to share her story of hope, her triumphs and challenges, along with her experiences living with depression, addictions, and suicidal ideations. Ms. Johnson's passion is to share the message to those who feel lost, hurt, and battle stigma from co-occurring disorders. There is hope and treatment out there. Never be ashamed of your journey, for God can use your story to help others understand the reasons why. Never give up. And with that, we'll give you Ms. Johnson.
Well, good evening, everyone, and thank you so much for being a part of this important conversation, this important town hall. Again, my name is Rhonda L. Johnson, and I am an author, a Washington Certified Peer Specialist, and the CEO for now, like right now, Hope to Reality, LLC Certified Business Enterprise. My company now, Hope to Reality's mission is, as Anna said, to address education, hope, and innovative solutions for co-occurring disorders regarding addiction, mental health, suicidal ideation, and the opioid fentanyl crisis by bringing awareness to the implicit biases that society is facing before, during, and after COVID-19 through my books, speaking engagement, facilitating work groups, and webinars. In the year 2018 and 2019, I became the founder, lead organizer, and visionary for the walk entitled DC Walk for Recovery. This free, non-sponsored event took place on the National Mall across the street from the African American Culture Museum and the National Monument. With the support of a committee, volunteers, in-kind donation, and love from people who believe in recovery, we did something that has not been done to bring awareness, intervention, prevention, and solutions to change the stigma and negative perspective from those who have addictions and mental health challenges together from the DMV area. It has been said that when people recover from addiction and mental health challenges, they are able to see things clearly. People in recovery think differently, talk differently, and live differently with a clear assignment for others not to do or not to go through the hell of living a life of depression, despair, and death. As an author, I have been charged to bring to light and to start the uncomfortable conversation about the affects and effects of co-occurring disorders, better known as a silent epidemic that no one wants to talk about. So I would like to ask a question. If you had to choose between a mental health disorder or an addiction, which disorder would you choose? Better yet, I would like to ask someone to share in the chat, what is the true definition of addiction? Put that in the chat. This is a question that many residents and native Washingtonians have been asking themselves since the crack cocaine epidemic. See, we do recover. I am one of many native-born Washingtonians who stand with the DC Rap Action Network to celebrate that education, hope, and integrative solutions, along with stage-wise treatment that Miss Angela Moss Baker, my teacher, told me, make sure you know, stage-wise treatment, what it looks like. Tonight in Washington, D.C., October the 4th, 2022, there are children crying. There are children who are hungry, and there are children suffering because someone in their family has an addiction, and because of their addiction, they are homeless. To those who have joined us tonight from different agencies, nonprofit organizations, and those who work within the behavioral health treatment centers, as well as the welcome politician candidates, I have a question for you as well. What is it going to take for those who suffer in silence? See, addiction and mental health is not just those who are living in despair and impoverished communities. Addiction, because of COVID-19, has brought to light for persons who suffer in silence, who, because of their job type, position, and status, are not able to share with others that they have a problem. Most importantly, how do they not be judged, stigmatized, discriminated, or become a part of a stereotype category that will call them an addict? I understand, because no one understood that I lost my mom, who was 55 years young, and my dad, who was 57 years young, who died 1 year apart, and who were married for almost 40 years. No one felt my pain. Even though I was married, I was 39, 40 years old with 3 children, no one treated my depression, and no one understood my addiction. Because of stigma, most facilities said I was an addict, yet no one, until the correct treatment and diagnosis for co-occurring disorders, could understand. I was able to recover and become a peer leader and advocate that I am today. I had a family. I was brought up with love, and today I love me, yet I was an addict. As we listen to the candidates and you, the participants in the chat, it is important to share what's next for recovery beyond the Department of Behavioral Health for outreach and engagement workers who may be underfunded or not funded at all, who are out here doing the work and they're not being noticed. This town hall is one of many to come to encourage and provide hope for the masses that recovery is more than drugs and alcohol. Recovery is a way of life. In my conclusion, I do want to share that I am a proud mother of 3 adult children who have stood by me in my dark and my depressing, despairing days. I'm grateful that I have a support system that gave me, my children I'm talking about, they gave their mom love when I was lost and nobody understood. Today, both my sons are firefighters for the Alexandria Fire Department. 2 of my children graduated with bachelor's degrees, and my daughter, before becoming a homeschool teacher, taught children for a living with her bachelor's degree. I just want to share the stigma, because their mother was an addict who suffered with depression, who had suicidal ideations. Don't count us out, okay? To get together, my 3 children who are married gave me 12 grandchildren who call me Gigi, AKA Gorgeous Grandma. I leave you tonight with this message. First, thank you all again for joining us today for this important conversation. No matter what stage of manifestation, from the caterpillar to the butterfly you are in, whether it is the beginning, which is the caterpillar, or the evolving stage, which is the cocoon, the learning curve, which is in flight, or the soaring stage, which is the butterfly. Each stage of transformation is your awakening to help others understand that they are not alone and to never give up. For if I would have gave up or would have died, I would have missed 12 angels sent to me, along with my nephew and nieces, and one special one named Bam Bam. I would have missed it. And they let me know that I'm needed. And what I want the candidates to understand is recovery is important. If you're not here tonight, anybody that's on this town hall, and you're not talking about solutions, then you're the problem. And that I, along with others in recovery, and the peer movement, because the peer movement is so important right now. We have the answers, and we're asking you to listen. We have been through the storm, but we have come out on top. The peer movements are necessary and have been chosen to impact, change, and transform the world. Again, thank you all for being here. and enjoy the rest of the DC Rap Town Hall.
Wow, thank you so much. Ambrose and Rhonda, you both just touched some major points. So we're gonna get we do our candidates are here. And again, there's a link to some of the question that was asked of our candidates, and I'll just repeat it. Many voters want to know what you will do to address the opioid and fentanyl crisis in DC. After listening to the recovery community in DC, the barriers we have heard most often were inadequate access to care, justice-related issues, and discrimination due to stigma. If you want to earn the recovery community's vote, what will you do to prioritize the behavioral health changes that need to be made in the district, and what type of resources can come to mind that would best address the crisis? Now, they only have 5 minutes, so we're going to let them speak for that 5 minutes. We do have a timer, but again, in the chat were the answers, so if they don't get to get all the way to it. And I'm going to call in the order of your names, and you alphabetize by the names. Okay, so that's how we're going to call on our delegates who are here today. So the first delegate, and I don't know if I see him in the chat room, but we had John Cheeks, who's running for the chair of the city council. Did he come on?
He's no longer running.
Oh, okay, thank you. Okay, so we're going to go to the next delegate, and that is Nate Durant, and he's running for chair of the DC City Council. If you could unmute, and we have 5 minutes for you.
Yes, thank you, Anna. I won't take all 5 minutes. I just have 3 points to share. First, I just like to say, I wish for everyone who's struggling and making progress on their way to overcome addiction and have sober living and a clean living. I applaud you, and I wish you the best, and I hope you all succeed in your endeavors. The second thing I'd like to talk about is just the bigger picture of the opioid crisis, and how regrettably there's some things that local political figures won't be able to do for you. So let's talk about fentanyl for a moment. Mr. Ambrose Lane Jr. brought up that it's in a majority of the drugs that are in our district. And also fentanyl comes from China. China brings it to Central America, and it's currently coming through our southern border at increasing rates than it has in the past. This is due to a policy from the Biden administration from ending Title 42. So there's been a lot more immigration or immigrants that have come over, and governors of some southern border states have creatively decided to ship them around the US. And I think DC's received, we had at least 4,000 immigrants from Central America that came in as of a few months ago. Regrettably, our council, I'm thinking of Councilmember Nadeau right now, she called all of the people who are getting shipped to be asylum seekers, which is so naive and highly misleading, because fentanyl and drugs are coming, as well as I don't even know if there'd be asylum seekers. I need to check on the definition. I know there's a few lawyers who are also candidates who can clear that up for me. But the fact is, our council has decided that we're a sanctuary city, and we don't allow federal law enforcement to prosecute, or to actually, we don't assist federal law enforcement for help for getting criminals who brought drugs from other countries into our district. We don't allow, we're not allowing federal law enforcement to help clean up the issue. So that's a big picture overview. It's really strategic. As chair of council, there's a few things I could do, but those are just variables that are out of the council's control, the mayor's control. Unless you, I would say, let's stop being a sanctuary city so we can help get rid of criminals who have brought the drugs into our town. I know it'll be impossible to get rid of fentanyl completely, or other opioids, amphetamines, whatever, but that will help decrease the supply. And that's one thing that I would do. The last thing I'll mention is, if there's anyone on here who can help me get a tour of the methadone clinic on Good Hope Road. I walk by it all the time. I'd love to get a tour, and just send me a message on nateforchair.com, nateforchair.com. And I'd love to get to know more. My name's Nate Derringe. Thanks for having this forum. I think I sort of addressed what I would do to address the opioid crisis but happy to take other questions in the chat. You can just message me personally or put it out there. Thank you.
Thank you, Nate. Okay, we're going to go to our next delegate, and that is Eric Goulette, and he is running for Ward 3, Board of Education. If you could unmute.
Thank you, Anna. Can you hear me okay?
Yes.
All right. Well, I just want to thank Aaron, Anna, and then Rhonda also for their personal stories that they share with us. And Ambrose, always, I work right now as a special counsel for the Committee on Health. So I'm excited to continue working with Ambrose. We worked for many years on these issues and excited to continue doing so. I think some of the things that we've done already to try to get ahead of the opioid crisis, and Ambrose, you framed it well. A lot of jurisdictions, opioid overdoses are pills. In DC, it's almost all contaminated drugs through fentanyl. I mean, heroin was the big culprit. And, we saw recently, as Ambrose pointed out, increases in the youth, the age that we were going to clubs, and then the increases in the older adults, particularly during the COVID period where people were dying at home from this. And one thing we've tried to do is make sure that all of our first responders now carry naloxone and Narcan. That's something we push for. For a while, we received resistance from MPD on it. We've gotten them on board, and in the process saved dozens of lives by making sure that they carry now Narcan, and it's not just FEMS that's carrying it. The other things that I want to talk about, because I'm running for the Ward 3 State Board of Education, is what we're doing for our children right now. And two things the council's done that I think are really important in terms of destigmatizing this and getting youth to be able to feel comfortable that they can talk to someone at school are creating a school-based mental health program that gets counselors in every school, and then pushing for every school to have a full-time 40-hour-a-week school nurse. And we're still struggling. We add nurses each year on that, but the challenge we continue to experience is nursing shortages in DC. So we want to be able to recruit and retain nurses in DC, and we're going to continue to push on that. I think one thing we also need to emphasize with our youth in our schools that's going to be really important is just that with fentanyl right now, there's no room for error. We need to stress with our youth and educate them about the dangers right now that are inherent in purchasing drugs over the internet or even doing drugs once, because fentanyl can kill a first-time user if it's in the contaminated drugs that are purchased. And we really need to get that message out to our youth about the dangers that are out there right now. Also, we need them to feel comfortable if there's a family member right now who's struggling with addiction, that they can feel comfortable speaking with somebody without worried about that being divulged or in any way being stigmatized. And then there can be a process in place through the school to get the family member help and get them connected to services in the city. So for me, it's all about removing a stigma, getting our youth to be able to trust the adults in their school, and making sure the adults are then trained to be able to connect a youth or their family to services. I think we've done a lot to make a difference in this, but it's a challenge in DC that's going to continue as long as fentanyl comes in through contaminated drugs. And really the ways we do it, we continue to increase education. We continue to increase Narcan and naloxone, make sure that's available in every possible place that we can where there'd be overdoses, and that includes in people's homes. And then finally, continue to fund DBH. We've increased DBH's budget for our providers. There's certainly more work we can do there, and I would love to continue to work with DC RAP to figure out what targeted areas we can focus on with our provider community to be able to make a difference in providing those services. So I really thank you for your time tonight. If there's a question round at the end, I'm glad to stay for questions. But Aaron and Anna, thank you for hosting tonight, and I appreciate the ability to join and talk about my candidacy.
Awesome. Thank you so much, Eric. We also have our next speaker is Rhonda Hamilton, and she is running for the mayor. So we'll let you unmute.
Greetings all, and a special thank you to the DC RAP community for the invitation. This matter is something very near and dear to my heart as the daughter of a military soldier and hero who lost his addiction struggles to heroin long before we understood the definitions of opioid and PTSD understandings. As the next mayor of Washington, DC, one of the things that I'm most concerned about is the lack of continued accountability and transparency in dealing with matters as important as this and others. We have at least a dozen agencies across the district that are failing our citizens on the community level in one form or another, and all of them are impacting our communities as a whole. When we talk about the opioid concerns and the loss due to fentanyl and the deaths across the city, three things I want to point out, although there are many things that we can talk about. Systemic setbacks cannot be ignored. Systemic setbacks as it relates to the poor investments in the Black and Brown communities. Headlines across the nation talk of the economic divide in our dear town, which definitely has focused on contributed to a lack of focus, I should say, for the proper investment in resources. We've spoken on the mental health or the lack thereof. We talked about funding DBH more. I'd like to see more accountable, transparent understanding for the misuse of funds across this administration when it comes to matters as serious as drug abuse and addiction. The understanding of the AMA's letter to Congress recently asking that they would enforce the understandings of the 15 years of failures in complying with the 2008 Mental Health Parity and Equity Addictions Act. The fact that we're not getting the proper focus and funding in these areas are what is of concern for me. The negligence of the mental health services, as I spoke on, we have to understand that our community members are using drugs as a result, in many cases, of unresolved matters of trauma. We have invested, for example, east of the river, $300 million in a brand new hospital. And as I heard Mr. Lane mention, he's still advocating for a 24/7 drug facility. I'm concerned that the misappropriating of funds for what we truly need as Washingtonians is something that, as a new administration, I'd like to dial down on further. It's important that we educate our general public about the dangers of fentanyl. As one of our fellow candidates just mentioned, just 2 milligrams of the fentanyl is lethal. 45% of the population in district is made up with Blacks, but yet we represent 85% of the opioid-related deaths. And that is so important that our general public is properly educated so they understand the true dangers of what we're dealing with. We also understand that the folks that are most likely to continue troubled in this area are our citizens who've been using heroin and opioids for years and now are struggling to find ways to manage their drug usage supply. Also, it's important to understand that Black and Brown families are the ones that most likely need the care, but are most likely not going to seek the care. So as a mental health advocate for the last 5 years on the ground, it's been very important that we advocate for culturally relevant resources and medical professionals. I heard Rhonda Johnson, who spoke so eloquently about peer advocates and the importance of having lived experience, reach out and relate to our citizens. And our communities, Black and Brown in nature, we don't trust easily. And our medical community healthcare inequities play a large part into why so many DC citizens are going without the proper care and resources that they need. I am also concerned that the negligence in our ability to provide the appropriate resources to our citizens will continue to have DC show up on the list as being rated high as what was it? I saw on the list we were number 4 for citizens that are likely to overdose or use drugs. We have several indications of statistical data that support the fact that many Washingtonians are suffering from matters of depression and anxiety, which are true gateways to drug usage and abuse. So I feel that it's important, as the next mayor of DC, that we have empathy in the position in order that we can humble ourselves to the many community level resources and professionals who are calling for higher dosing caps when it comes to the issuance of the I'm talking faster than my mouth would allow me to say it. But for many of our citizens who are not receiving proper dosage in the medications and need prior authorizations, for years, many of our medical professionals have been advocating for the systemic setbacks that exist in the district for being able to treat our families of drug addiction and drug overdose realities. Yes, addiction is a chronic, lifelong condition, and it disrupts a person's life. The most important thing that we can do for the many citizens in the district is to pay attention to what each individual's journey is, and to give them the dignity of supplying them with the proper level of resources and funding in order that we can move past this pandemic. I thank you for an opportunity to speak today.
Wow, thank you. Thank you so much, Rhonda. We appreciate you speaking. We're gonna call our next delegate, and that is Frederick Hill, running for council at large. If you could unmute, please.
Okay, can you hear me?
Yes, we hear you.
Okay, thank you so much for the invitation. Congratulations to all and the many others who are winning in the sobriety game. And I personally have quite a few family members, employees, all that have been winning, and some not as successful, but are very familiar with the challenges that come about. And specifically answering the question as to what am I going to do? I see and know that there is a shortage of resources. I also see that there's an enormous level of mismanagement and mishandling of the funds in the city. One area in particular that I can say should have a redirection of its funds is our newly introduced violence interrupter program. It does not carry the level of success as what I see the peer success that comes from the advocates in the recovery community. The other thing that we need to look at is when we look at what puts us at risk on the support and protection side is that our officers and our MPD has been defunded. Now, when we are properly funded, there are task force that could have more staff that could help intercept the transformation of those drugs into our community. And when we ignore that, it seems that everyone else takes their chances at picking with us by using that disadvantage to get their drugs into this city. And it also affects our young in the most negative way, just as everyone else has mentioned today, which is all great and all good and all that we must do to win this game. We cannot forget that there must be a serious investment in mental health. Not everyone that has a mental health challenge is considered to be crazy. But sometimes if we don't understand conflict resolution or solution challenges that we come about, then we make the wrong decisions. And sometimes when life gets to be too heavy, that wrong decision could be one more drink, one more drug, and then one more life. And so what I will be pushing for, as I said first, is to make sure that we have the proper resources that go out to the advocacy groups, that go out to the peer instructors and support groups to make sure that there is someone who cares within the community that a recovering addict could go to. And then make sure that we are supporting the team that carries the authority, and that's the MPD, to make sure that they're funded properly. We need to also make sure that when it comes to housing justice for everyone in this city, that there is a strong consideration as to what does it really cost the city when we do not make that right investment. Every voter in this city is an investor. Every voter in this city is an investor. And when the resources that we invest in or the services that we invest in do not come back and benefit the community, then we have the wrong people leading this city. So I will be one who makes sure that everyone understands that I am familiar with the challenges that we have here, and will be doing whatever I can to make sure that we have more people celebrating long-term sobriety. Thank you.
Thank you, Mr. Frederick. We're going to go to our next delegate, and that is Kareem Marshall. I'm running for council at large. If you could unmute.
Can you hear me?
Yes, thank you.
Awesome. I don't think I'm going to take the full 4 minutes, but I did want to say good afternoon and thank you to the recovery advocacy community for hosting this event. I'm really excited for the opportunity to share a bit of my backstory and most importantly, to hear from members of the community as they share their needs and their lessons learned. My name is Kareem D Marshall, and I'm running to be the next at-large DC council member as an independent. I'm asking for 1 of your 2 votes, and I'm number 2 on the ballot. I'm a 3rd-generation Washingtonian, a proud product of DCPS, a graduate of Dartmouth College and American Law School. I'm currently the general counsel for a nonprofit, and I also teach environmental justice at American Law School. But before that, I was a DC government employee. I worked for the DC government for about 12 years. I wrote laws, I implemented programs, and I worked on advancing equity east of the river. I know what this government does well, and I know what it does poorly. And I am also very good at making broken systems work to serve the people they're supposed to. Now, most of our forums have been events where the 6 or 8 of us stand in front of an audience and try to distill extremely complex concepts in about 60 seconds. And I don't think any of us actually likes that structure, but those are the rules, so we play by them. But I hope we all can agree that the issues that face this city are a little more complex than minute-long rehearsed answers. So I'm grateful for the opportunity to talk in a bit more detail about what I think I can do to help our residents who are battling addiction and make sure that they have more successful recovery stories. I'm really looking forward to hearing about what your community needs to be successful. What can be improved in treatment facilities, what our nonprofits could do better, and what our government could be doing in order to meet your needs before they become a crisis. If you could indulge me, I'd actually like to use a little bit of my time to talk about why I think I can be helpful to this community. While I am not battling recovery, and I've never had to battle addiction or face the stigma of trying to manage recovery, like most families who grew up in the district in the 80s and the 90s, I've seen the struggles of a person trying to navigate recovery. Now, my grandmother passed right around the time that I graduated from law school. She was a very giving person. She fostered like 30 kids, she adopted 3, and up until the day that we put her in hospice care as she was battling cancer, she was trying to manage my uncle's recovery. I watched my uncle battle addiction his entire life, and my earliest memories of him are him under the influence. But my most treasured memories of him are those brief moments of sobriety where he was successful, where he could do something simple like watch a football game or show up to family dinner. By the grace of God, my grandmother moved on to the next phase of her existence, believing that her son was well on his way to a sober existence, but unfortunately he was not. When she passed, her death triggered some of his mental health issues. And that's one of the interesting things that you raised earlier, that as we talk about addiction versus mental health, we need to stop pretending like this dichotomy has to exist. A lot of times these things coexist. But when he suffered his mental health issue at 2 o'clock in the morning, the only resource that was available to the District of Columbia to send to him was a guy with a badge and a gun. So, being scared, he fled in the middle of the winter during a snowstorm. So by the time they found him in Prince George's County, it was too late to help him. So what I will tell you is this: while I am not a member of your community specifically, I am dedicated to being a useful ally. An ally who understands the importance of centering the voices and experiences of the communities I seek to serve. For the recovery community and for any community seeking respect and dignity, I promise that as your next at-large council member, I will elevate your voices and not have the arrogance to think that because I know you or because I've heard your experiences or that because it's touched me tangentially, that I have the right to speak on your behalf. My proposition is simple. I ask you to look at the state of the city and ask yourselves, have the current council members done everything they can to ensure that there is more hope today than there was 8 or 10 years ago? Have they done everything they can to provide opportunities for jobs, to create housing that normal working people can afford, to spread peace and safety in our neighborhoods? If you think we can do better, I'm your candidate. If you know that your council should be more concerned with your quality of life than press releases, ribbon cuttings, or photo ops, then I'm your candidate. If you think our government could be a little bit better, a little bit smarter, a little bit more thoughtful, then I'm your candidate. I would appreciate one of your 2 votes this November. My name is Kareem D Marshall. I'm running for at-large council member, and I'll be number 2 on the ballot. I hope to be able to earn your support, but most importantly, I am really looking forward to hearing more of the stories of the members of your community. Thank you for your time.
Well, thank you. Thank you so much, Mr. Marshall. So we're going to go to our next candidate, and that is David Schwartzerman, and he is running for the DC Council at Large. And with that, I'll give you David.
Yes, thank you. 5 minutes is very generous, much longer than we usually get. And I want to thank you. I'm here really to learn about the crisis from people who are experiencing it, who have a history. And let me say that I'm a native-born Brooklyntonian, but I've lived in DC since 1976. I taught at Howard University for 39 years. I've been retired for 10 years now. So I'm going to first get into really what I indicated in my questionnaire. First of all, this crisis should be a priority, and apparently saving lives is such an obvious priority, and it's really sad and rather shocking that it isn't yet such a priority for our local government. Let me say that harm reduction is really an effective remedy, as already mentioned, and naloxone it should be widely available, as Ambrose Lane, emphasized. That's an important initiative, very important initiative to save lives. My youngest son, Sam Young, is a social worker in Portland, Oregon, and he's volunteered for quite a few years for harm reduction in his community. And he's really informed me on how critical this kind of outreach is. Let me emphasize that I think that decriminalizing drugs as a step to legalization, ending the war on drugs, will go to the root of this continuing crisis, impacting drug users and the community. And of course, resources in terms of staff and outreach service must be provided. And I attended a very informative webinar not too long ago from the Health Alliance Network, and learned about how treating violence as a public health challenge. And by the way, I support defund MPD and refund the community. And let me share a statistic that I uncovered a few years ago and testified to the Committee of the Whole on, and that is the life expectancy gap between Black and white residents is not only shockingly high. In 2016, it was 17 years shorter life for Black men than white men, and 12 years shorter for Black women than white women. And that was 2016. It was actually, the gap grew since 2000. And now it's even greater because of the differential death rate from the COVID pandemic. I think this is shocking. And I think it tells us that the dominant policies of our DC government, which I've described as trickle-down economics, which privileges the few over the many, has driven this and tolerated this life expectancy gap, which I would say, do Black lives really matter in DC? Given this data, So now let me go to a more hopeful path that I think we can actually make real progress. I first ran for office in 1998 and several times since, and I always emphasize the focus eliminating child poverty. As I said in the chat, this should have been eliminated years ago. We have a more than ample tax base to address this issue. And I'll put my website, my campaign website in the chat, and you can find a lot more details on this. But last summer, we made the people of DC won a very important victory. And that was a tax hike on the wealthy, which was passed. And as a result, a lot of the targeted revenue went to the DC Earned Income Tax Credit to match the federal. It went to house the homeless as well as early child educators' income. And this was actually opposed by the Federal City Council, which is the powerful lobby of the big banks and the developer sector, but they were defeated. And I would submit that we can open up a path to more victories for the people of DC, particularly the working class of DC. But from this victory that we had last summer, but that will take organization. If I'm elected as one of the 2 votes that you have, I will use my office to organize more victories for the people, because it's not only the council negotiations that make that possible. It is organized groups that are fighting for human rights in DC. And I've been a long-term human rights activist. By the way, I'm a climate scientist, the only one running for the council at large. And this is a very important issue, which also bears on health of the residents, particularly east of the river, who suffer from more air pollution, the harmful effects of air pollution. And so we need to take more proactive action.
Mr. Schwartzman, I hate to have to stop you, but your time is over.
Thank you. And for the many, not the few. That's my campaign slogan. Thank you so much.
Okay, thank you so much. Okay, so I'm going to ask, are there any other candidates that we may have missed? I know some did come on, so I don't want to, and I don't know, I see some cell phones on here. So if you could unmute and let us know you're here. Okay. All right, so we will go for that. We're going to take this time now and do some first of all, we want to thank all the candidates that showed up. This is just wonderful, and you all have given us a lot to consider and just think about, and just your knowledge on recovery in the recovery community. I know as a woman in recovery, I appreciate each and every one of you for showing up. That means a lot to us. We are going to take some questions, and I'm going to ask Aaron, do you see some questions in the box? We'll get the questions first that were in the chat. And then we'll take some hands just in
Yeah,
case.
let's try the
That's okay,
hands.
the candidates.
Yeah, I mean, if people want to re-put their questions in the chat, it's hard to follow what there's a lot of conversation. And so
Oh, yes.
people want to either like
chat.
virtually raise your hand and come off of mute and ask. You can ask a candidate specific question or the whole like an open sort of question. I see Tracy T.
Yeah, I see Tracy and then
Uptown
Sassy
DC.
Mama.
Yep.
So we'll go with the hands, Aaron. So we're going to go with Tracy. If you could unmute, and then
Yes,
if you
and if
put
you
it in
are
the chat.
more comfortable asking a question in the chat, just put it down there and I'll try to get it out there as well. Go ahead, Tracy.
Hi, I'm Tracy. Thank you all again for bringing this topic to this platform. It's been wonderful. My question is, what services or provisions is made at the polls, at the voting sites for people that may have mental illness and display symptoms? As a poll worker, I do know that there is nothing other than security guards, and some people who have mental ill. I mean, there's reasonable accommodation for people who can't walk, people who can't hear, people who can't see, but there's nothing in place for residents who may display mental illness, and also training the Board of Election Workers on the proper language, like not calling people crazy, things like that. That could be a barrier for a resident from voting. I know we have the mail-in ballots. Some people can't read. Some people handshake. There's many symptoms. So I was just wondering, that's just what are we doing to make sure that everyone, including the people of behavioral health community, have access to the voting polls? Thank you.
Kareem has his hand up. Would you like to answer that?
Yeah. So I worked for the DC government for 12 years, and one of my responsibilities was building out the language access program in the Office of Administrative Hearings. But that also meant making sure that the office was ADA compliant and compliant with with all of our rules around making sure that none of our organizations are unintentionally discriminating in violation of the DC Human Rights Act. And unfortunately, the answer that I have to give you is that the district government does not do a good job in making sure that we are protecting the rights of folks that are suffering from issues of mental illness. And this is not just in issues of accommodation and voting. You can also see this in the way that we deal with people who are experiencing a mental health crisis. We don't have enough of a robust support around making sure that we treat it as an illness as opposed to something that is disturbing the peace of the people who are affected. So what we need to do as a government, and this is something I would focus on as a council member, but I would expect the other 12 members plus the AG and the mayor to do this as well, is to have a mindset shift where we pivot to thinking about this as an issue of treatment and accommodating folks who have needs, as opposed to protecting the peace and quiet of the community. Because if we can actually provide that safe space for people that are going through either an addiction crisis or a mental health crisis, then that actually creates the safety that we're looking for, as opposed to just making the person who's popping up and looks like a disturbance go away.
Thank you. Eric, is your hand raised?
It's like Eric. Yep.
And I read recently a DC bar was putting efforts into this as well. And I think the article talked about guardianships, for individuals who may have a guardianship, and then, some of the stigma that they face in determining capacity at the polls, whether they have capacity. And I think the DC bar is working on this. So there may be legislation in the works. So I think this would be a really great opportunity to connect with representatives from that organization, connect with the DC recovery community, and then also, perhaps get legislation proposed for the next council period that would look at this, because it's also an issue for residents that may be experiencing dementia, who may come to the polls, be confused, and may need help. And the issue of capacity, I think, is really important, because we want to make sure that poll workers are trained, that they're sensitive, and that we work with individuals. Because for some, I know individuals experiencing dementia, there may be some days, where they, have greater capacity than others. So being able to find that opportunity to allow them to cast their vote and be enfranchised is really important, I think. So there's a lot of work to do on this. I think, if DC Bar is moving forward with the information from their forum, I think it would be a great opportunity to look at a potential bill for next year. And I think just making sure, poll workers are trained and sensitive on these issues is helpful, but I think we need kind of a concrete solution in place with the DC government, because it's a complicated issue in terms of determining capacity to be able to vote. So we should keep working on it.
Thank you. I didn't see any other candidates on that. So we're going to go to I'm going to say Sandra, but you have Sassy Mama up there.
Call her Sassy Mama.
Okay.
Mama's
Hello,
up.
hello,
Love it.
everyone. Hello, everyone, and good evening. Thank you very much. And my name is Sandra Sanders, and I am a certified peer support specialist. I'm a certified recovery coach, and I am also a woman in recovery, 18 years and counting. So everything that's happening now, I've already been through. And I don't really per se have a question. I just want to use my voice for the people that do not have a voice, because recovery is possible for everyone. So the people that I serve in my career, I go to the street every single day, armed with these. This is Narcan, armed with this, fentanyl strips, and armed with my experience of being an addict. I go to the streets. I try my very best to pull those people in, you know what I'm saying, and share my experience with them. So we pick up the phone, we call a government agency, and we get a voicemail. This person may be suffering from mental disorder. I understand mental disorder because I suffer from mental disorder too. So do we treat the addiction or the mental disorder? So we got to pick one because they are one in the same. Do we treat the mental disorder first, then the addiction, or do we treat the addiction, then the mental disorder? Those people are people just like everybody else. All of the candidates, they're people just like you. And what I have found was it's the hardest thing in the world to get government assistance from the telephone. The COVID thing is still here, so we can't go to the office because I'm willing to put that addict in my car and take that addict and fill out that form for that person because somebody did it for me. Addiction is real in Washington, D.C. I live in Ward 8, but I hit every single ward every single day in my 8 to 11-hour shift. Every day. I have no problem standing in the middle of a group of addicts, active addicts, because with a bad decision, that could be me. So the question is, what do we do? Not just me, because it can't change just me. But I'm willing to get out there and put my boots on the ground, not be in front of a screen, not being on TV, none of that. Right in the middle of them, passing out Narcan, passing out fentanyl strips, passing out new syringes, which is called harm reduction. The reason we pass out new syringes, at least we know one time that person used a clean needle and not one is fully infected with something. That's called harm reduction, not encouraging the addict to use. You know, so I just wanted to share my spiel, my experience. I'm going to keep my boots on the ground because just like recovery was possible for me, it's possible for the next addict. But we have to start treating addicts like human beings and not like they're germs because addiction can happen to anyone. Thank you.
Thank you, Sandra. I tell you, yeah, lived experience. Who better to know than someone who's been through it? Yeah. And I see one of our candidates' hands up, 2 of them, and then we will go to Ambrose. Well, I saw Moselle. I think she was up, her hand was up there, and then so then we'll go to Moselle, Ambrose, and I see Durrell. But we're gonna go to Rhonda and Fred, who are 2 of our candidates.
Rhonda, you want to go first?
Thank you, Fred. I just wanted to acknowledge what has been said and what Sassy Mama so eloquently put, that mental health is important. As a city, we've been struggling with understanding that it's each individual's walk. And in order to recognize the individual is to provide the dignity that there is levels to mental health. And not everybody requires medicine, not everybody requires treatment, but everybody requires acknowledgement, right? And what I mean by treatment, there's some folks that have been living for years with their addictions, and there are many things that work, but because there's not a totality of education and understanding for the folks that are implementing the laws and the legislation, it does not trickle down to what our community needs. And my concern and why I'm running is because this current administration has not demonstrated that they understand matters of community. The money's being passed around, but our community members are not getting the level of help that they need. The first step is to recognize that in mental health, everyone has a personal walk with what they're dealing with. And it seems that our city is trying to lump in this one for all treatment or remedy for individuals without first understanding the underlying core issues as to why that individual is spiraling. We've got to be a city that recognizes the individuals for just that, an individual who has a personal walk with their mental health challenges, and begin to put comprehensive care systems around that individual that will integrate with drug usage as well as with their community social determinants that we haven't talked a lot about. And I just want to make certain that we all recognize that until we deal with the social determinants that are present in these communities and the underlying trauma that exists, we will not touch the surface on what that individual's walk is and why it is that they would come to use or abuse drugs. Thank you.
Thank you, Rhonda. You get it. Okay, we're going to go to Mr. Hill.
Thank you so much. I've got a short response, but it was to answer the question that was asked is what happens and what can we do? In short, you have the opportunity come November 8th to begin to make the changes in this government that have been much of the problem along the way. These things that I'm talking about, and specifically is the mismanagement of the funds and the resources that go through this city. We've watched over and over again agencies in this city that have aided in the almost $1 billion of waste and abuse. And one agency in particular is the Department of Housing and Community Development, which almost pushed $200 million in the last 2 years. $200 million had to go back to the feds for mismanaging the money. But what happens is that instead of holding that agency accountable and its staff accountable for mismanagement, they come back to the people, the hardworking people of this city, and they increase a tax or create a tax. They come out with all these different things that we're going to pay for to keep the same amounts of money there that still does not reach the community and the community's needs. So it has to start where, along with all the other education, all the other firsts that everyone mentioned, understand that if you do not change the players, it's going to be the same game played on you again and again. And right now we need to make sure that we send a message to those who are on the council right now, in the mayor's seat, in the attorney general seat, those that are seeking election, that they have got to include everyone, not just the rich and wealthy in this city, and not just those who have their hogs at the trough, if you will, those same few people that always seem to eat. We need to make sure that we have all people considered. So I thank you again for that time.
Thank you, Mr. Hill. We're going to go to Moselle, Ambrose, and then Durrell. And then we do have two council members. I see, well, two members with their hands up. Mr. Schwartz and Mr. Kareem. So
Miss Jones, I just wanted to answer Miss Sandra's question real quick. She asked, what do we treat first? And I think that's a conversation that we need to be deferential about. But the most important thing is that we have to make sure that we've structured our response in a way that allows somebody who actually is competent and familiar with the needs of the community to be able to make that decision. Like, is this something where the addiction is crippling right now and that needs to be treated and then we can stabilize? Or the person who needs to make that decision is not those of us who are aiming to be on council. The person who's best suited to make that decision are the people who are on the ground out there doing the work every day. Our job as council members is to make sure that the resources are there so that those people aren't worried about putting food on their table as they're serving the community.
Hey, Anna, I think we have one, I'm sorry, I think we have one more candidate that's here that just jumped on. Can we give Red some time?
yeah, Brett, Brett, which position are you running for?
I'm running for Mayor Washington, D.C., independent candidate.
Okay, go ahead.
Yeah, Anna, do you want to ask that question just so Red gets equal
Oh.
time? Just to,
All right, Brad, the question was, many voters want to know what you would do to address the opioid and fentanyl crisis in DC. After listening to the recovery community in DC, the barriers we heard most often were inadequate access to care, justice-related issues, and discrimination due to stigma. If you want to earn the recovery community's vote, what will you do to prioritize behavioral health changes that need to be made in the district? And what type of resources come to mind that would best address the crisis?
No, first of all, we got to get into our communities. Recently we were in Ward 8, and it's so many people in Ward 8 that are addicted to opioids, fentanyl, and we sit back and act like this is not happening. We have a crisis going on in our communities right now, and people think that they're going to just put a Band-Aid on it. We really have to deal with the mental health issues that are happening in our communities. We got to deal with the boots on the ground, people who can really get involved with helping people, who care about people. And we put a lot of money in. Sorry about that. Can you guys hear me?
yeah, you're okay.
Okay, cool. Thanks. Someone called. We put a lot of money into certain services, but we don't put the money into the people who really need the help. We need to really put the equity into the people who really need the help that are in these communities. These communities have been crying out for years for help, and nobody is listening. And if we don't put the equity into it, we're gonna have a community that's continuing to spiral down that path of drug use, opioid use, fentanyl use, heroin use, and it's going to tear our communities apart. We already have families torn apart from drug use. So I'm looking at, as a leader and the future mayor of Washington, D.C., to put the money into places that people can go to recover, because people need recovery centers. We took all the recovery centers out of the community. People cannot go. There's no hospitals for them to go. And it's nobody who really is on the ground to help our people to get better. This is a community thing right now. If we say we care about our community, we got to show the love, care, and respect for our community and get out there and work together. All of us is in this forum tonight need to start working together. It's a lot of people in here tonight. We're not working together. We're working against one another. But we say we're community. We got to start working together as a community to heal one another, to heal our communities and get people better, because there's a lot of sick people in our communities.
All right. Thank you, Red. Appreciate it. Thanks for keeping it under the 5 minutes too. I appreciate that. And sorry, I didn't mean to cut Moselle off. I know you're next. We just want to make sure we give all the candidates time. Go ahead, Moselle, ask your question.
Hi, family. Hi, everyone. Hold for 1 second. Hold on. Yes. My question is, how can we have better services for those who are struggling with addiction? I'm a long-term recovery person. I've been sober and clean for 30 years. And I've been in this field as long as I've been sober and clean. And I have previously worked at PIW, Psychiatric Institute of Washington. And I see some things there that I really didn't like. The way people are treated with addiction and mental health issues, the stigma behind it, the way that they downgrade people, the way they talk down to them like they less than human. People who struggle with addiction don't need that. What they need is dignity and respect, because they're human beings. They have an issue, but they don't need to be downplayed or disregarded or treated like some trash. And I saw this. I have seen this over the years of me being in the field. And I've been in the field a long time, since 1992. you know, and I try to make a difference in everyone's life because I share my story because I have one. And I try to give hope to those who are feeling hopeless, you know, and it's not a lot of treatment programs. It's not a lot of treatment programs in the city. So what can be done to make that happen? That's my question. Thank you.
Thank you, Moselle. So I see I'm trying to get it from the our delegates. So I see Mr. Schwartzman's hand is up. Mr. Hill's hand is up. Is also Mr. Goulette's hand is up. So we'll get those three candidates to speak.
Thank you. I'll be very brief. I want to thank Ambrose Lane Jr. for this chat comment. Again, I came to this to learn. I'm not an expert in this area. Certainly Ambrose is, and he emphasized that, especially for the opiates, fentanyl and so on, we need the resources in place before decriminalization occurs. So thank you, Ambrose, for making that point. I just want to make a quick comment on where the resources can come from to fund the services that are necessary. A lot of our taxpayers' money is going to subsidize the developer sector, which is building more luxury housing and market rate housing than affordable housing. We know that. This is a housing crisis in DC. And the majority of people cannot afford market rate housing. And so the existing Housing Production Trust Fund is actually, the way it's been functioning is actually eroding the supply of affordable housing for the majority of residents. So we need to shift our, our tax-based money from subsidizing the luxury housing and market rate and move it to affordable, truly affordable housing, and to programs that are needed, that save lives. That's really the bottom line here. One other example, I mentioned the tax hike on wealthy residents that was passed a year ago, but the corporate and developer sector continues to get federal tax cuts from the Trump legislation. Why don't we recover at least some of that by hiking their tax rate? And then we'll have more revenue to address these unmet needs that we all recognize in our community. Thank you for that time.
Thank you, Mr. Hill.
Okay, there we go. Thank you again. And I just wanted to say to Ms. Moselle, thank you for your service and thank you for your success in sobriety all these many years. You stand as that example that's one of the things that need to be done. They need to have access to more people who can show the pathway to get there. But the main thing that we need to keep in mind, amongst many of the other things, is again that if we don't hold the current government as a whole accountable to how they manage our invested dollars, they will continue to skip over the needs of what all of us need throughout our communities. We can no longer sit by and just watch the rich and wealthy keep getting rich and wealthy when there's other services that can be supported by this government and our invested tax dollars. If we take the tax dollars that we are already investing now into this $20 billion budget, and we as the voters in this city carve out the necessary amounts for our advocates across the city in homelessness, in mental health, in addiction crises, with all the other many different, our youth, our senior citizens. You know, I was on O Street the day that someone got shot over there in front of the seniors facility. And what was disturbing to me after speaking to a number of people as to why this was a known open-air drug market for so long was that many of those who were in the facility were keeping the drug market open. They were keeping the supply moving because they were the demand. The government, which was MPD and other agencies, didn't do enough to make the community safe, even for those who were addicted. And so, again, as I said before, we've got to empower, refund our MPD, allow that task force that deals with those people who are bringing the drugs, bringing the guns illegally into this city and having a negative impact on our communities to be dealt with. And then on the side of where we talk about those who are, let's say, apprehended for the possession of these illegal drugs, at that time, that's when those wraparound services can begin to work. This person may not need to be charged with the possession and sent to prison for 5 years, 10 years, but they do need some sort of help as to find out why and what led them down that road. So if we're gonna hold those people accountable who are bringing it in here, then we interrupt. That's where an interrupter comes into work. We interrupt the supply so that the people don't have that opportunity to get it as easy while we direct them to the real services that can help them turn their lives around. Thank you.
Thank you, Mr. Hill. We're going to get Mr. Goulette, and then we are going to go to Ambrose. And I do want to hear Daryl's, Daryl has a question too, but we'll get Mr. Goulette.
Oh, thank you so much. And I want to touch upon the last two questions together, really. The question about there being, which do we solve first? And this used to be a real dilemma in DC because we had our Addiction Prevention Recovery Administration was under the Department of Health, and then we had a Department of Mental Health. And what we found is, individuals would come in with co-occurring issues, and whichever agency they presented to, they would treat that one first, and then maybe they'd have to go to the other one later. But what we did is we combined them into a Department of Behavioral Health, which I really do feel, and there's been a lot of criticism. I'm not going to get into it with any of my, other candidates in other races here, but I really do think there's been progress under Dr. Bazran. I think she, when we came in, Dr. Royster was in there. There's a lot of discontent in the provider community, and I have seen progress. But to Miss Mazelle's point, we've got a ways to go. And she asked, how do we get better at this? And I think we do what we did when we combined APRA and we combined, our mental health agency. We don't need to do it formally, but we need to connect people who may present with a substance use and mental health issue with other things to help keep them stable. And the two I would think of immediately would be jobs and housing. And those are two things that really, if somebody presents with a substance use issue, really can help keep them stable. And if somebody has a stable job and they're in stable housing, they're much more likely to be able to stick to a regimen, to be able to stay sober. And I think that's really important. And just finally for our youth, I mean, I got to the pleasure of starting my career out right out of law school with our Ward 8 council member at the time, Sandy Allen. And some of you may remember Sandy from many years back. And this was back in 2003. And one thing I want to do with our youth as a member of the State Board of Education is really expand the amount of after-school opportunities they have and expand summer programming. So we don't ever have our youth feeling they need to get involved in drugs or in selling or using drugs. And, I look at the summer youth employment program. I think it's hit or miss right now sometimes. If you have a great employer, it can go really well. If you have an employer that just warehouses the kids, they don't get quite the holistic experience we want. And one thing Sandy told me is that some of the kids in Ward 8 will be in high school. And she said, you won't believe it, but some of these children have never left Ward 8. And that blew my mind at the time. But what we want to try to do, I think, over the summer is give these kids a holistic experience throughout the city, to be able to see things, to be able to go through Rock Creek Park, to be able to see our museums, to be able to experience a number of jobs and really see the opportunity out there for them. And right now, we're still only at a 70% four-year graduation rate. And I really don't want to lose 30% of our youth. I want to make sure that we're connecting our youth to programs that keep them away from drugs, that keep them in school. And so they see a future for themselves in this city, and that they see a path where they're going to succeed and be able to contribute and thrive here in DC. So those are the things that I think I support in the area of substance use and youth. And I appreciate the time.
Thank you. Ambrose?
Yes, thank you. First, I just wanted to congratulate you, Anna, and Aaron, for this. I am very and just so impressed with this forum. I really tip my hat to the both of you. I'm so happy to be a part of this piece. And Anna, you've been hounding me from the very beginning about being a part of this. And I'm just so happy that I have been. I'm gonna, recovery, for if none of these candidates learned anything, they need to understand that recovery is lifelong. It's lifelong. And but there are things that have to happen before recovery starts. And when we talk about infrastructure, we're not just talking about simply a sobering center. Sobering center is good. I've heard comments saying Dr. Bazran has made some progress. She has made some progress, but let me just be real with this. At our event, she spoke and she said, it's not a sprint, it's a marathon. And I only agree with half of that. I do believe it's not a sprint, but it ain't no marathon. Marathon's 26 miles. Why can't it be a 5K? And that means that we need to apply resources. It doesn't have to be a 26-mile marathon. It can be a 5K, okay, if we apply the resources. That's number one. So I have two specific questions for all the candidates. Number one, will you publicly support the need for a 24-hour treatment center in Ward 7, where there has been a 26% increase in opioid deaths? There's only one 24-hour treatment center in the city, and it's all the way up in Tinley Town. That's where the problem ain't. It is in east of the river. Do you, and not just the treatment center, not just the drug center. We're talking about with embedded wraparound services so that before they even leave the building, they can get access to mental health right there through telehealth. They can get access to a connection for stable housing right there before they leave. Because what's happening, and just to explain to everybody, they might get a treatment at the hospital and then they get a referral. And that referral says, hey, go see Dr. Chapman so you can get buprenorphine treatment, or go to housing so you can get some housing. And they don't understand the person that's on substance use disorder most of the time ain't gonna go. So you have to have that treatment center have those wraparound services embedded in it. Before they leave the building, they get access to the other services. So the number one, do you support that? The second thing, do you support the need for peer specialists and recovery coaches to get paid a salary to do the work that they do? Those are specific policy questions that I'm asking all the candidates.
And thank you. That's the
I'm
question.
good.
We're going to get all the candidates, but we're only going to give you 1 minute to answer. So it can't be a long answer on that.
Maybe it could just be yes or no.
We truly want to hear that. Yeah, the recovery community. I see Mr. Grant's hand has been up, and then we have Kareem, and then we have Rhonda, Nate, we got to hear from you. And then Fred, I'm just going down where I'm seeing the hands. And after Fred, we have oh, there you go, Eric. Okay. All right. So we'll go in that order. 1 minute, please.
All right, well, first of all, great question. Yes, I do support. We have to make sure we support in all areas. Tinley Town is not where the problem is happening. It is in wards 7, 8, 5, and we got to have places for people to go immediately. And I do support our peers to get paid as much as they work. They work super hard, and all of the people in our city who are working boots on the ground should be getting the money and supported in these places, in these areas. The problem I have is we never support the people who really are doing the hard work. So the people who are doing the hard work need to get the most money. That's from our peers, that's from the people who are social workers, that are from wraparound services, that's from teachers, That's from people who are really helping these young people out in our community. They're giving all this money to people who are not really doing anything to really help anybody, and they picking and choosing who they want to give the equity to. Let's give it to the people who are directly connected with our young people and the people who need the help the most in our city. That's what I care about. That's what I want to make sure I bring to the seat of the mayor of Washington, D.C.
Thank you, Mr. Red.
Mhm.
Kareem?
All right, so I could answer this in the chat because my answer is yes to both. Clear, emphatically, absolutely. I think our treatment centers need to be just like we've done for short-term family housing, is that it needs to be small, it needs to be less institutionalized, allow people to come in, feel safe, get treated, and move on. But the one thing I did want to add is that some of the challenges we have with funding the people that actually do the work is the indirect cost recovery model that we have for a lot of these nonprofits allows them to spend 30, 40, 47% on administrative overhead, which means that the people who are doing the actual work on the ground level don't see that money. I think we need to be more efficient and more diligent about making sure that these folks that we give money to are actually paying the people who are doing the work.
Thank you. And if we're going in line by how we see it in the order, then Mr. Schwartzman, you would be next, and then it would be Mr. Goulette. Goulette, pronouncing it wrong.
Yeah, thank you. Of course, I support Ambrose Lane's proposals, and I will articulate them in the coming candidates forums as well. We have to have follow-up and not just making commitments here. We have to have follow-up and organize to make this possible. So I put that in the chat, and thank you. I'm not going to take any more time.
Thank you. Mr. Goulette.
Thank you very much. And no worries on the name. It's pronounced like the French Canadian singer Robert Goulette, who only people my age or older remember. So people don't know how to pronounce it anymore, but that's okay. So on Ambrose's points, I mean, first of all, on the peer specialists, absolutely 100% Ambrose. And I think we need to do that at schools too. We need to work with our youth to be able to get youth specialists who can connect with students in the schools and talk to them. And then there's a place that those students feel safe going to, somebody that they trust as a peer. So yes, I'd be happy to work with you on that, Ambrose. I think it's a great idea and I'm excited about it. You know, I do want to talk to you more about the Ward 7 Center. I'm excited by the idea of it. What I want to understand working with you is how it would coordinate with the new hospital on the St. Elizabeth's campus. I think we definitely need to be able to connect residents immediately to services. But it sounds like what you're talking about is a 24/7 center where people present with either immediate psychiatric issues where they need a bed or immediate substance use issues. So I want to understand, because that capacity was supposed to be at the new hospital, which will be 24/7. And I want to see what the need would be in Ward 7 versus with the new hospital. And then also to make sure that as we do that, you know, we have then staff on hand from agencies that can then connect people to those services. So I think it's a really interesting idea. I don't want to give you 100% commitment on it because I want to follow up with you, have a conversation with Kim Russo and the folks at the new hospital, but I'm definitely intrigued by it and I'm excited about the idea. So let's talk more.
Real quickly, the hospital so far will not have wraparound services embedded. That's the issue.
Okay.
That's the issue. They won't have wraparound, so it won't be hub and spoke. It won't be the Rhode Island model. It won't be what Dr. Chapman has been trying to tell us to do for a long time. It'll just be treatment, maybe some other things, but it won't be access to services on site.
Okay, well, let's talk. I'm excited to hear more about it, Ambrose.
All right.
So let's do it.
Okay, Mr. Nate.
Right. So for question number 1 on the 24-hour treatment center move to Ward 7, and I support that in general, especially if it's revenue neutral, it's a no-brainer. But I think as a district, we have to be smart when it comes to how we're providing services, and we have a centralized location, one-stop shop. That's a good thing, and I'm supportive of being efficient and effective. For the second question on peer specialists and recovery coaches, I thought the Kareem Marshall brought up a good point. There's some it's like a very technical, very specific means type question that I don't feel comfortable supporting right here without doing the research and seeing what's effective, what's not effective. But in general, moving services to where they're needed, I'm supportive. Thank you.
Thank you. Rhonda?
Yes, Ambrose, emphatically, yes, I support a 24/7 facility east of the river. You know me. I have put my advocating on the ground for the last 5 years on hold so that I can step up and run for mayor. Those of us on the ground know of the grave disconnect. I saw it mentioned in the chat box here, the disconnect for the follow-up of wraparound services. We have a strain on our emergency rooms and our medical facilities. We don't have enough community connections and linkage for families who are still going through. We understand that west of the river, there are at least 4 level 1 trauma centers, and we're told that east of the river, we can only get a level 3. And we all know east of the river that mental health is 24/7. We're closing a 330 bed facility and the new facility falls short. So emphatically, yes, Ambrose, I do support a 24/7 facility because we have a capacity issue even as we usher in a new $300 million hospital. And those of us on the ground east of the river understand what that means. And I emphatically also support our peers, advocates, all professionals who have vested interest in making sure that our community members get the resources that they need in order that their standards of living can be raised. We have a strained social service system. You don't have to take it from me. Just talk to any of our social servants for the child family welfare systems, as well as our social service case managers. We have a problem east of the river with helping families get to higher standards of living. We must be intentional moving forward, and we must support employing advocates, peers, and other professionals to help the district with their gap in services for families east of that river. Thank you.
Thank you, Ms. Hamilton. So we just have time for 2 more questions for our delegates to answer. So I do see 2 hands up. I see Sandra. What is your question?
Hi, I'm Sharanda Watkins. Hi, Ann. I'm glad you.
Hi,
Sharanda. How you doing? I live in Ward 2 in the single member district 2G03. And I keep hearing about Ward 7 and Ward 8. My concerns, Mr. Hill, is what is MPD, what is the council doing to help combat the drug trafficking that's bringing the violence on O Street in my cooperative? I would like to know what we as cooperative members need to do to assist. I actually decided to campaign and run for ANC commissioner in my ward because I've gotten tired. I'm just so frustrated of seeing the drug traffic on O Street, the violence. It's like it goes from 7th and O and P Street to 5th and New Jersey or N or O Street, and nothing's being done. I actually watched. I can see what's going on, and I'm like, something's wrong with this picture. If I can see it, clearly there's nothing being done about it. I don't know if it's all of these new mandates about funding the police or what the police officers can do or can't do, but it has to be some sort of balance or divide or something that I can say to our community leaders, for the people in my cooperative. Most of them are scared, are frightened. The children are running. When we take our children, my neighbors, when they take their kids outside to play, they have to sit out there with them and watch and listen. And nothing seems to be done about it. I want to be able to bring some of these concerns to the council to see how we can help. We're not saying we're going to just sit by and do nothing. We're asking how we can assist with eradicating, combating all of this violence and the drug trafficking that's going on.
And sad but true, a lot of the license plates of those that are coming
Maryland.
in our cooperative are from outside of this city.
Mhm.
If I can notice it, we got trained officers that definitely have to be seeing the same thing. So I want to know, how can we assist? Please, somebody let me know. We're ready.
All right.
Well, I'll since you called me, I'll be the first to respond with number one. What needs to be done is first, everyone needs to understand. I've never seen anyone dial love, peace, understanding, or a violence interrupted when they're in trouble. But everybody dials 911, and if you don't have enough officers to respond, then that's the only authority that can come in and deal with the situation like that immediately. There's no one else that can do it in this city. Now, what we are faced with right now in regards to MPD is that every time there's a phone call right now, and this is straight from MPD officers, every time there's a new call that comes in, each district right now has roughly about 2 officers to answer that call, whereas before they had 15. Being defunded, those same officers are now working 12 to 18-hour shifts, not what they're working before with an 8-hour shift. If we have bad officers, we deal with them individually. We deal with them. You don't throw the whole bag of apples away because you have a few bad ones, but you save the seeds. And when you save the seeds, you can plant anew when it comes to MPD. The other thing that needs to be done is that just as you are in the community, develop a coalition of those who can have a regular contact and communication with MPD, the mayor's office, and the council. And I will be one to help you get that message across. I don't have to be on the council to do that. I do it with the residents of Marbury Plaza and other areas across the city right now, and have been doing it for the last 7 years. So I would like to connect with you now and begin to establish those relationships with MPD, the mayor's office, the attorney general's office as well, because these are also things that, these are agencies and heads that typically haven't worked together when it comes to the needs of our communities. And that's another part that we have to have. We have to have a unified effort if we're going to win this war.
Thank you, Mr. Gill. I'm going to get to Mr. Marshall.
So I think one of the things that we've had, I think all the candidates, right? Like mainly for the at-large race, but all the candidates in this race, the mayoral, the AG candidates, we've all had to answer this conversation about whether or not 4,000 police officers is the goal for the city. And when I declared, that was the first question that they asked me. And I'm gonna say now what I said back then. That question is a distraction. That question is set up to play to your fears. Yes, crime is bad. Yes, there is violence in our streets. Yes, there are issues about response times. The question we need to be asking ourselves is not whether or not 4,000 is a magic number or 5,000 is a magic number. Unless, of course, I just want to scare you into voting for me. But if I want to be honest with you, what I'm going to tell you is we have our police doing too much. Like, they're not best suited to be mental health crisis responders. They're not best suited to be people doing traffic stops. Like, that's not what you hire somebody with a badge and a gun to do. They need to be allowed to focus just on the things that cops are good at. And that's responding to somebody else that's trying to use violence. Let's send our cops for that. Now, after we've done that, once we stop having our cops do all these extra jobs that they're not suited for and they didn't sign up to do, then let's have a conversation about whether or not we have enough police officers. But let's take all the distractions off of their plate first and have them do what they're supposed to be doing. Then we can have a conversation about staffing.
Thank you, Mr. Marshall. I see Mr. Grant and then Mr. Goulette. I hope I pronounced it right.
I do want to make sure, yeah, I know that, I don't know how to, I want to make sure I'm saying it right, but my secret Valentine is running for office too. I want to make sure that candidate gets some time, but go ahead, Red, and then, yeah, go ahead.
Well, I agree with Ms. Schrander Watkins that it's happening all over our city. You know, crime is affecting every part of our city and every ward. And Ward 2 is definitely being affected also. I'm a husband of a retired police officer, and we talk many nights of how we can get our situation together here in Washington, D.C. And one thing we have to do is grab our young people up early enough and start, loving and caring about them early and putting these programs back into our society. We taking so many programs out of our community that was helping people like myself, growing up in Southeast Washington. I had 14 Boys Club. I had recreation centers. I had things to do, music, and anything else my mama wanted to put me in to keep me out of these streets. And it was around us also. I had to catch the bus from Southeast all the way to Dunbar every day, pass through many different neighborhoods. But if we don't put these programs back into our city and help our young people, my program like Don't Shoot Guns, Shoot Cameras has helped over 600 young people, and we got to put programs like Beyond Your Block. I heard Mr. Goulette talk about taking them off their block. My program like Beyond Your Block, who's taking them to the White House, taking them to the African American Museum this summer and different places. We have to give our young people culture also so we can give them opportunity to succeed. And that's one of the problems when you take these programs out of our communities and you think that, the crime is going to stop. It's not. Everybody in here know we only had 85 murders 8 to 10 years ago in our city. Now we got 230 murders and it's rising. And it's not going to get better if we don't put the programs back into our communities and come together as a community. We got to have proper community policing that's really happening. And I don't know, I went on a ride along recently in Ward 7, and the police officers told me that, no matter how many police, the crime gonna be here because, their hands are tied a lot of times to even deal with the criminals out here in society, in our society that's wrecking our communities every day. They the ones that's causing the problems in our community, and we gotta be tough on certain people in our community. They can't continue to do the same thing over and over and over again. We letting them back out on the street. And we need more diversion programs to help our young people who are savable, but some people are just going to be menaces to our society, and we got to get them back into where we're in control and not they're in control. I want the grandmothers to be.
I'm going to have to get it to Mr. Goulette, and then we're
Okay.
going to get Larry and let you all answer the next question. And then we're going to probably have to end for the night. But okay, so we'll go to Mr. Goulette.
Well, thank you very much. I mean, this issue was talked a lot about during a campaign for Ward 3 Council. And, I do think that the number 4,000 is a bit of a distraction because that would be so far off in the future that we would be looking at. I mean, right now, our number of officers is probably going to be around the 3,700 level. And it's going to take many years to be able to staff up to 4,000. We would be talking 5 to 6 years. If that was possible, because what we're doing is we're losing many officers through attrition, officers who are retiring or officers who are getting jobs elsewhere. So, the hiring the mayor is doing is only netting about 35 new officers this year. So 4,000 is well into the future. That number, came up from Chief Kathy Lanier. I worked with Kathy Lanier and Ward 7 resident Paul Quander, who is our deputy mayor for public safety and justice. And, I really did appreciate a lot of the law enforcement techniques they used because it didn't focus on, punitive measures. A lot of it was on deterrence, and they had officers really doing community policing, walking around, particularly at events, to deter crime over the summer, particularly when we saw a spike in it. And it was really effective. We brought homicides down to a 50-year low for a 2-year period of time. And we were staffed at 4,000 officers, but we didn't see an increase in arrest. What we saw was more deterrence. I think I do want to disagree with what one of the candidates said. I do think it's important that officers are trained in multiple disciplines because they will be first on the scene to many issues. So I think having them, we got a little bit of pushback initially on the Narcan and the naloxone, but I think that's a function they need to be doing because they're going to be first on the scene. And I like what behavioral health has been doing in training our officers in crisis response. So if an officer is first on the scene, they know how to de-escalate a mental health situation so it doesn't turn into a life or death matter if it's not one already. And then it gives time then for crisis response and behavioral health to arrive. But oftentimes an officer is going to be first on the scene. So they do need to be trained more and better in these multiple techniques to de-escalate or deal with different issues. Finally, just in terms of stopping crime, we're increasingly becoming a city of the very rich and very poor. And that's going to be a flashpoint for crime. Because if you have people who have nothing living next to people who have very much, you're going to have crime. I think we really need to work on rebuilding DC's middle class so that people can see a future for themselves in the city. And that starts with housing and jobs here in the city. So I think those are all solutions to solving public safety.
Thank you. Thank you. Wow. Okay, so this is our last question, and we're hoping that it's a question that we can get the candidates to answer. Larry?
Yes, thank you so much. And so I just want to, real quickly commend the candidates for really coming out and participating. This is phenomenal. I think it's the first time it's ever been done. And so just your participation and willingness to come and learn is huge, right? And definitely want to commend the organizers, DC Recovery, DC Rap, for putting this on. And so I just want to commend, just three things to the candidates and to the participants. Three things. One, stigma is still the biggest silent killer for both addiction and mental health. And it's alive and well, and it's even alive and well between individuals who have addiction and individuals who have mental health. They literally got a stigma against each other. And peers, I see a lot of stigma there as well. And that's not a bad thing. It doesn't make you a bad person, but that's really real. Number two, this is not about addiction. This is truly about co-occurring disorders, right? And this is about unaddressed, untreated pain, both emotional pain, which comes through adverse childhood experience, which comes through unaddressed, undiagnosed, and untreated mental health conditions that is being medicated by substances that then turn into addiction. And I'm not talking about your everyday anxiety disorder. We're talking about PTSD, bipolar, etc. If you're an African-American male with bipolar, you're more likely to be diagnosed and treated for schizophrenia than for bipolar. And that's been documented by Dr. Lawson at Howard. So I'm just saying all this is very complex. And the last thing I'd like to really commend and really ask the clients really to do a deep dive, and the participants here. DC in 2019 was awarded by CMS, where they get all of their dollars from for Medicaid, a 1115 transfer waiver. And that 1115 transformation waiver literally was authorization to DC, DBH, and DC Healthcare Finance to totally transform the SUD and the severe mental health healthcare delivery system. So that's really happening right now. So as we talk about these different issues and put these different things on the table, recovery centers, et cetera, hey folks, we're in the third year of a transformation authorized by CMS with the $3.5 billion DC budget. So we need to talk about it. Y'all all are right on track. Y'all all saying the same things. But if you haven't read the DC 1115 waiver, you are, I can't think of any other way to say it. You're totally misinformed, and you're not, speaking to what is actually happening and how you can really drive this. And so, lastly, in real estate is location, location, location. In terms of SUD and mental health in the district, it is 1115 waiver, 1115 waiver, 1115 waiver. Google it, pull it up, and let that guide what you're trying to do and really inform you of where the opportunity is and the nexus is. And we got to do more of these, Anna, because I'm telling you, it's a lot of misinformation. It's not necessarily bad. It's just that people don't know what they don't know. And it was just a lot of misinformation being shared and reinforced here this evening. And that's why this forum is so important, because if we didn't have this forum, we wouldn't know what people are thinking. And we can't address misinformation if we don't hear it. So Thank you,
Thank
candidate.
you, Larry. Larry, I thought you were gonna have a question, but you did
Yeah.
give us some knowledge. You always come out with the knowledge, and we love that. So we're
Well,
gonna definitely check that waiver out so that we can be familiar with that, right? Okay, so I see Mr. Goulette has his hand up.
Yeah, I mean, the 1115 waiver, Larry's absolutely right about that. That's something that we pushed for years, and I want to applaud the substance use community for coming in and testifying at hearings in support of that waiver. That's how we got that done. And you know, I think what and Larry, I think you'll know this as well, is a lot of our behavioral health communities started out as community-based organizations. And as we shift more services into Medicaid, and with the big shift over to Medicaid for behavioral health services, Medicaid's more complicated with its billing. But the good thing is we get federal reimbursement for those services. So, you know, the waiver is an incredibly exciting opportunity. What we need to do is continue to work as a city with capacity building for providers, making sure providers are trained in Medicaid, know how they bill Medicaid correctly, and that we then are able to not only take advantage of that extra federal money, but we make sure our providers are paid on time and that no provider goes out of business because of this shift. And I think that's something that's really important because we have lost providers as we've done this Medicaid shift in the past, and we want to really be focused on that. So if there's any concerns anyone has about that, feel free to get in touch with me, and I'm glad to work to help those providers on the transition.
Oh, thank you. Thank you so much. We are totally at time. This has been an awesome recovery town hall. Believe me, your DC RAP team will be having a lot more to promote what's needed grassroots in DC. So we're looking forward to sending out the information about the next one. I'm going to ask any of our team members from DC RAP, is there anything that I'm missing? I hope you all are looking at the chat because there's some awesome information that is in the chat that we weren't able to speak truth to.
Yeah, I was gonna say if the candidates want to drop their, if you have a website or you know an email that you want to drop in the chat, please do that. I think you know I too just want to thank the candidates for coming out and the voters, the recovery voters, and I just want to leave people with this is that you know, I think a lot of times where we look at like how we've tried to tackle the addiction issue or substance use issue crisis in this country, like a lot of times the strategies like go after the supply side, like you take out one cartel, another cartel is going to come. It's like it's always a never ending supply. The supply is going to be there. But if you invest in people, if you invest in recovery, if you invest in treatment, prevention, harm reduction, and community, then you are tackling that demand side. You are taking that demand away, right? And so I just want to make sure that, I mean, I'm sure that a lot of the candidates here have really kind of noticed that the people in recovery here that have all these ideas, we can be a resource. And so no matter if you get elected or not, you know, we want to make sure that you all know people in recovery have the solutions, you know, because they're living it. And so I just want to make sure that, you know, if you're elected, think about ways of how can we get this community more involved in those solutions and make that a reality, because we are a resource. And we vote in numbers, and we notice like as the night's gone on, more and more people have gotten on the Zoom, which is usually not what happens. And we also we all talk to one another in our community, in the recovery community, and so and so this is a community that the vote should be valued and courted, and that these relationships should continue to build before the election, during the election, after the election. So thank you all the candidates. I appreciate your time, and the recovery voters that shared your ideas tonight. Appreciate you all as well. And these will continue. We'll see folks on more forums in the future. So thank you all very much. Good night, everybody. Be safe.
And Aaron, did you leave a link for them to if any of the candidates wanted to join us for another meeting or join our monthly meetings, did you leave a link? So they
Well,
can
we have,
join?
yeah, let me put up, let me figure out the
We
best.
meet twice a week, right, Anna?
You meet twice monthly.
Twice monthly.
Mhm.
Yeah, I'll put something in the chat if you all want to stick around for a couple minutes to sign up to get like um
The invite.
invites. Yeah. Just give me a minute to find it on my computer. Other than that, thank you all.
And Aaron, I just wanted to say
And
that
congratulations, Sandra. Sharanda, I see that you're running for ANC. I love that flyer. It's beautiful.
Yeah, more people in recovery are running for office these days too, which is nice.
and I just wanted to
Hi,
remind
Miss Rhonda.
and Anna that the Opioid Solutions Working Group meets this Friday. I think you all got an invitation. Okay.
Oh yeah, everyone got an invitation. Great to be a part of the solution and what's happening with the opioid crisis. I encourage everyone to show up at that meeting. So did you put it, is the link in there?
Yeah, I just put it in the chat there.
Okay, but Ambrose, did you put the link for our the opioid meeting?
I did not. Can you all do that for me? I have to take care of something here at home.
I can do it for you because I can send it out from this.
Okay. All right. Thank you.
You're welcome. Thank you. Okay, and Erin has put it in there, so we got it. We have it in, yeah.
And look, to anybody that's attending, if you pull up a chat, there's a little 3-button thing on the bottom right that lets you save it so you can pull everything out of today's chat.
Yep.
Yeah. And I just want to extend
Marshall, I'm doing that now. I would have forgot to do it. I would have forgotten.
I've been, every time we drop a link, I've been resaving.
and again, I just want to extend a personal invite to all the candidates and anybody participating. I will extend a personal invite to have a conversation and discussion with you, specifically what's happening with the 1115 waiver and what that really means now. I'm telling you, it's just a ton of misinformation and misunderstanding. And we're totally missing the boat. And because we're missing the system that's driving the change that you seek, we're just not participating in that change.